Sexually transmitted diseases. Diseases or infections which are communicated through sexual intercourse are collectively called as sexually transmitted diseases or STD. They are also known as venereal diseases or reproductive tract infections. Gonorrhea, syphilis, genital herpes, genital warts, trichomoniasis, hepatitis B, and of course, the most discussed infection in the recent years is HIV, leading to AIDS, are some of the common STDs. Among these, HIV infection is the most dangerous and is discussed here that the virus. Let us see how does the virus looks like. AIDS virus. This is the virus is having a protein coat and it is also having a lipid. This is the lipid layer. Protein envelope contains, and then there is a lipid layer, and then again there is a protein coat, and this is this is the viral protein, and there is a single stranded RNA, which is the genetic material. Now, this HIV virus, how does it spreads? It causes AIDS, which stands for acquired immunodeficiency syndrome. It is a fatal disease. The disease of AIDS is caused by this retrovirus, which I have told you. This is a HIV virus. This is also known as RNA virus, and this virus attacks white blood cells or lymphocytes of human beings and weakens the human body's immunity or self-defense mechanism. Since AIDS virus reduces the natural immunity of the human body, therefore the patient suffering from AIDS becomes prone to many other infections or diseases. In fact, the patients suffering from AIDS die from other infections called secondary infections. Death occurs because the patient's body cannot resist the attack of pathogens of secondary infections, since patient's natural defense mechanism gets destroyed by an AIDS virus. Now, these diseases which I have mentioned, which are sexually transmitted diseases, except for hepatitis B, genital herpes, and HIV infection, other diseases are completely curable if detected early and treated properly. Early symptoms of most of these are minor and include itching, fluid discharge, slight pain, swelling, etc. in the genital regions. Infected females may often be also do not get any symptoms and hence may remain undetected for long. Absence of less significant symptoms in the early stage of infection and the social stigma attached to the STDs deter the infected persons from going for timely detection and proper treatment. This could lead to complications later, which include pelvic inflammatory diseases and abortions, stillbirth, ectopic pregnancies, infertility, or even cancer of the reproductive tract. And out of this, let us see what are the causes of these transmission of these diseases. How does an infected person affect the unaffected one? Some of these are unprotected sexual intercourse from the mother. The disease can pass on to the embryo which is in her womb, or during it can also pass during delivery or or breast milk when the mother feeds the baby. And also these diseases can be transferred through these syringes which are used by infected persons, and the blood products. So we know the causes of how they spread. So to for this these diseases are mostly found, high percentage is found among the age group of 15 to 24. And now we cannot if the once the disease happens, we cannot do anything other than taking medicines and all. But these are not easily curable, so the best method is prevention. How we can prevent ourselves from these diseases, from getting these diseases, is the number one: avoid sex with unknown partners or multiple partners. Always use condoms during coitus, and in case of doubt, a qualified doctor should be consulted.